against COVID. Now, these adults are not only protected from serious illness, they can also safely get back to activities they may have stopped during the pandemic. And we'll talk more about this at the end of the briefing. Of course, we still have a long way to go with vaccinations to reach a significant level of immunity in the population and to stop the virus from spreading. We need to continue to vaccinate more of the population, including adolescents and even younger children. This brings us to our second piece of news, which is Moderna recently announced yesterday that its COVID vaccine is safe and effective for adolescents 12 and up. Now, Moderna will now share those results of the clinical trials with the FDA and seek authorization to use the vaccine in this age group. Now let's talk a little bit about the status of vaccine distribution in our region. And I apologize, the slides are not moving with me, but we'll just go through the numbers here anyway. So to date, the vaccinations for Region C, we've administered around 1.7 million doses. So to be specific, 1,696,470 total doses of COVID vaccines. That number includes 970,000 first doses and 775,000 second doses. So continuing to get more people vaccinated within our region. Now, moving on from our vaccinations, let's turn to our regular hospital data. And again, apologize, the graphs aren't up, but we'll just talk through this. So we'll start with our regular hospital admissions. Our daily admissions number is now at 27, which is good. Our rolling 7-day average is also at 27. So it's a little bit above our green line, which is 25, but it continues to remain consistently low. So that is good news. And we imagine that that number is going to continue to decrease. On our hospitalization side, today we're reporting 132 patients hospitalized with COVID. The moving average now is 141 patients. And again, pleased to see this number is continuing to fall after that long plateau that we've had, since that March, April timeframe. And then it started coming down really in the very beginning of May there. And so hope to see that trend continue. A little bit more detail about our daily numbers. As we said, we have 132 patients that are hospitalized today with confirmed COVID. 37 of those patients are in the intensive care unit. 23 confirmed COVID patients on ventilators. Now turning to our suspected COVID numbers, we have 28 patients hospitalized today with suspected COVID. We have 4 suspected COVID patients in our intensive care unit, and we have 3 suspected COVID patients on ventilators today. Now moving on to some of our good news. Now since last April, we've discharged a total of 22,419 patients from our task force hospitals. And we added 26 more yesterday, so discharging 26 more. Again, a big thank you to all of our healthcare providers and everybody that supports them in the healthcare systems for getting these patients well enough to go home with their family and friends. Unfortunately, we're still seeing some deaths, although greatly reduced. So today we're reporting 1 COVID death in our task force hospitals, and the 7-day moving average has moved to 2 deaths per day. Now, if we can get our slides booted up, we'll go through some of our modeling numbers here in just a second. But let me just move on to our conclusion comments, and then I can just come back to the data here in just a second. So I think as you can see from our numbers that we've been putting up about hospital admissions as well as hospital census, that we continue to move in the right direction. Now we do have some days where admissions comes up and the census bumps up a little bit, but in general we're seeing lower and lower numbers across our community. So the transmission of the virus is relatively low right now, and fewer people are being hospitalized with COVID. So we're making good progress, but we need to make sure that we don't lose momentum with this progress. Okay, looks like we got our slides back up. So I'm just going to briefly run through these, and then we'll jump back to our closing comments. So this is, again, our models that we update every Thursday. And so as I mentioned last week, the numbers had dropped since last week, and this is really reflected in that tail end of the data that you're seeing here. And also a tightening of the confidence interval. So if you remember last week, those blue lines were fairly separated, but now they've really crunched down a lot more. So continue to decline, getting below that best case scenario. So hopefully that will continue. And then with our ICU status, that hasn't dropped as much as the total census, but still it's in that lower sort of threshold. So we're comfortable with that. Would certainly love to see that number come down even more. Looking at our epi curves from across the region, not a whole lot to report from these. Still low numbers. It continues to drop, and we'll show that here when we look at our prevalence data. So nothing big to report from our epi data across the different communities. Looking at our scorecard here, this continues to show good signs. We're down to around 3.3% of total beds being occupied by COVID, and around 7% of total ICU beds occupied by COVID. So if you remember last week, that number was up a little bit. It was close to 10, and we were, a little bit concerned about it. Granted that these numbers are going to go up and down, but this continues to come down, so this is good. Our new admissions, as I mentioned before, were right around 26. Again, just above that threshold where we consider ourselves in the green. That level is around 25. Then our prevalence of cases, again, has dropped in, this is a sum of 14 days prior, and then it's divided by per 1,000 population. So as the number of cases continue to drop, this number will continue to drop. And we're around 1.1 right now. Still in our red zone where we're still, cautious because there's still quite a few people that continue to become infected with the coronavirus, although greatly reduced from where we were before. And we're headed in the right direction. And then our weekly change, so this is, again, it is reflected in our weekly change, so this sort of shows the velocity of the change. So we're at a minus 16.5%, which compares immediate 14 days to previous 14 days and looks at the difference. And so this is where we are right now. Our positivity rate, below 5%, I mentioned that last week, so we're in a good spot there. Hopefully this will continue to drop, but around 4.6%. And then our transmission number, the RE, is around 0.9. Like to see that lower, but any time we're below 1 is a good thing. Hopefully we can get that number down to where we were previously, down into those 0.7 numbers, so we can really get transmission tamped down into the community. Okay, so I'm just going to pick up where I left off with my comments, and that is sort of fits well with the last data that we looked at. But COVID is still present in our region, and it's going to continue to spread among people who are not vaccinated. And some of those people will get sick enough to be admitted to the hospital, and some will end up in the ICU. And unfortunately, some people are still dying from what is really a preventable disease. Other people are going to go on and have a really prolonged illness with the long hauler syndrome as well, and have healthcare problems long after they recover from the acute infection. And again, it's from a completely preventable disease. So we all need to do our part to prevent that spike that we saw last summer, which was around the July timeframe, and prevent any more deaths from occurring like we had last summer as well. So as we head into the holiday weekend, let's be smart about how we celebrate. For those that are fully vaccinated, of course, you can travel safely together. You can gather with family and friends that are vaccinated without any of the extra precautions, because we know that the vaccine is safe and extremely effective. Now, if you're not fully vaccinated, you should really continue to take those steps like wearing a mask and social distancing to protect yourself and your family and your friends and those around you, especially if you have somebody in your life that is not vaccinated or has other health problems that's not vaccinated. Now, we really don't want to see any more people's lives upended by this entirely preventable disease. And nothing would really make us happier in the healthcare system, I think I speak for everybody, than to have no one in our hospitals or ICUs with COVID. And so if you haven't already, please make plans to get your COVID vaccine. It's readily available across Missouri. Anyone over the age of 12, through pharmacies, public health departments, mass vaccination events, which I know are ramping down, and other providers. Now, it's up to you if you'd like to get vaccinated. You can find options through the Missouri Vaccine Navigator website, which is covidvaccine.mo.gov, and through the Vaccine Finder at vaccinefinder.org. So if you start your vaccination now, you can be fully vaccinated and enjoy the protection and the benefits of vaccination by Independence Day. That would be nice. So that concludes our update for today. Just a quick program note: we will not be doing our press briefing next week, and then we'll pick up the following week. And with that, we'll take some questions from the media.
Health departments have been moving away from mass vaccination clinics towards smaller targeted events. What are some of the advantages and disadvantages of smaller scale COVID vaccine clinics?
Yeah, so the advantages are they target the population, and so many of the populations that are being served now with some of those smaller events are there's different challenges that are involved with getting some of those populations vaccinated, whether they're not comfortable coming to a mass event or they don't have transportation or any of a number of things. So it is much more targeted with some of those tougher groups to get vaccinated. The thing that makes it more challenging, though, is, of course, whenever you're breaking up any operation into smaller parts, logistically, it just makes it that much more challenging, especially if it's like a Pfizer vaccine where once you thaw it out, you kind of have to use it. And so you have to be very organized from the operations side. So making sure that you have enough people registered to get vaccine, that they're actually going to show up. And of course, getting vaccinators and the paperwork and all of that thing organized. Whereas with a mass event, it's you can run it at scale. So there's advantages and disadvantages, but it's just it's where we are in the pandemic. We always knew we would get here, and so we just have to work through it.
You've talked about COVID long haulers returning to the hospital in previous briefings. Mm-hmm. Are those patients included in the COVID census data, and how does their treatment compare to that of a newly admitted COVID patient?
Yeah, so they're different in our data as well. So they're not included in the acute data. So the data that we report in our census data as well as our admissions data is the active COVID infection patients. Even so much as when a patient is no longer what we consider infective in the hospital, they'll drop off of our census numbers because they're really no longer actively infected with COVID. So the challenges of these different patients are, of course, due to what their sort of prolonged symptoms are. So, for instance, if it's somebody that has some heart problems from COVID, then it's focusing more on, taking care of their cardiomyopathy or their neurologic problems if they've had a stroke, or their breathing problems if they had some lung damage or something like that. Whereas with the active infection, it's much more about treating that active infection. So a lot of issues with pulmonary and oxygenation and ventilation, things like that. So it's just a different set of problems. So I will say, though, that we have a number of patients that spend a lot of time in our hospitals post their infectious period because of all of those lingering symptoms. And so, when we present the data about hospital census, that really doesn't paint the entire picture of what the impact of COVID is on the healthcare system, because we have people that have been there for long periods of time, even though they're no longer active with COVID, but we still have to take care of them. And then people are readmitted for problems that have developed because of COVID, even though they don't have active infection. And so really the numbers we give out on our briefing are somewhat conservative because it doesn't really measure the total impact to the healthcare system because of those long hauler syndromes and all of the other things that we've talked about.
That concludes our list of questions. Thanks for watching.